There'll still be a lot more work that needs to be done. But the changes that the recommendations that we make in this report, our charge was to streamline government, to find efficiencies, and to save money in doing that. And I think that we've done that and more. We've worked hard, come up with a lot of solid proposals. All of those proposals, no matter what they are still going to need additional vetting, and it is my hope that once we are done with this report, that it will move on to other committees, and that those of us who serve on those committees will try to keep them moving and have them ushered through.
Even if we did not face an astounding fiscal deficit in the state, a lot of this work of this commission should be considered, and much of it implemented anyway, even if we had a surplus, because it will make our government more nimble, give the government more flexibility fiscally so that resources can be allocated to help enhance agency outcomes, as it were.
Well, I'm hopeful that we as a body continue to push this document. It needs to have another life. It needs to go beyond here. And if it's not going to be taken up in the Public Health Committee, it's not going to be taken up in the Appropriations Committee, it's not going to be taken up in GAE, then we've all wasted a lot of time, and I don't think that's what we want to do.
During the budget process and committee process, I think this allowed us to take the 20,000-foot view that we need to take in public policy, and I think this is going to be a very useful document, both in terms of changing policy, but in terms of addressing the budget. And I agree with Representative Minor, and I would ask that we work with the committee staff and OFA and others, at least within the purview of the Appropriations Committee, to break down the recommendation by our subcommittees.
We haven't really gotten much press on this, and I really find that ironic, because all we hear about and what this last election was about, to a large degree, was about cutting state expenses, becoming more efficient, becoming more effective, and here we are doing it to the tune of $0.4 billion, or a little more than that, over 2 years. It's absolutely, and it's not. This is not. And we're going to have differences on this, but this is not material that was not well thought out. This is research. We've been working on this for a year and a half, almost 2 years, and yet, where's the press?
Well, we thought we'd give them a little coverage on this. Joining me now to talk about the report are two members of that commission, State Representative Craig Minor, who is the ranking member of the Appropriations Committee, and State Rep Russell Morin, who is the House Chair of the Government Administrations and Elections Committee. And gentlemen, thank you both for being with us. I appreciate it, and particularly thank you for making such a long drive out here after I know you were quite busy yesterday. So
we're just about cooled down.
It's very nice to have you here.
Long ride for me, Diane. I'm pretty tired myself.
Yeah, I know. Coming up from Wethersfield was tough. Let's start out by talking about the overall breadth of this report. It was quite extensive. I was reading through it yesterday. You really went into quite a lot of detail and a wide scope. Can all of those things be implemented? Is the report really going to go into some kind of an action plan now, or is it going to be ignored?
I think some of them actually are part of the governor's budget. Certainly there have been some changes with regard to the operation of motor vehicle, some of the recommendations on payroll. I think some of the lively conversations we've had over the last month about what's the proper staffing level for management, all those I think have been taken quite seriously.
Yes, in fact, some people have said actually the governor went through and cherry-picked the ideas that he liked and put those into his budget. Is that true?
Well, I would hope that he did.
Yeah.
I would hope that he looked, and I believe he did take the work seriously. Have to give a lot of credit to Jamie Spallone and Gail Schlossberg for their leadership on this. But we certainly anticipated and wanted this to be a useful tool for the governor to help us with the situation we're in, and I think he's done that.
This, if everything in this report were implemented, how much would the savings overall be? I calculated somewhere in the $250 million range in the first year. Is that right, Representative Minor?
Well, I think there has actually been quite a bit of conversation about what the real numbers are.
Yeah.
When we went through this process, the committee had certain staffing levels, and we did the best I think we could to establish what those savings might be. The true savings are developed by the Office of Fiscal Analysis, which is the nonpartisan arm of the state of Connecticut. So when we put a figure on something like reducing the amount of mail or reducing payroll amounts, I think they were estimates at best. I don't think we really know what the savings could be. I think the efficiencies kind of roll themselves out, but certainly I think with regard to motor vehicle, very simple one having to do with the mail, I think the estimate was $1 million, and I think that's what's in the budget.
When you talk about payroll, one of the things that was proposed was direct deposit for all employees.
Right. And that's part of the CBAC agreement that hopefully will be ratified in the coming weeks. But it was for those people, state employees, people that are on unemployment, retirees, and again, it's just another way of reducing paper. So we'll talk about carbon footprint at some other point, but looking for ways to save money. Does it solve the budget crisis? That particular issue doesn't, but it's a good step, and I think it's the way to go.
Let's talk about that issue of supervisory or management personnel. During the governor's campaign, he talked about too many layers of middle management. One of the things that was addressed here, in fact, one of the commissioners felt he couldn't even vote for the report because of his questions about reducing, and that was Mike Cicchetti, reducing supervisors and management personnel. Representative Minor, how many people do we need to manage those people?
Well, as I recall, his conflict was focused primarily around the judiciary and OPM, and that the designation of being a supervisor, the Attorney General's office was another one. If you were an attorney, you were a supervisor.
Yeah.
So I'm not sure that we really know what the number is. I do think we very clearly saw that in some of the healthcare agencies, when you had 5 and 6 layers of management supervision, we had heard it from those that provided the actual services to the patient, and we heard it from other people that you shouldn't have to pass a piece of paperwork up 5 levels before somebody made a decision. I'd like to think that the numbers are significant. I think probably the reductions that could occur in the state of Connecticut are in the thousands, not in the hundreds.
You agree with that?
Oh, I absolutely agree, and it's the goal of the commission was to get the management ratio somewhere between 1 to 10, which was modeled after other states and business models as well. We took into account not only what other states are doing, but what companies and corporations are doing, and it's very important. And I think for the rank and file, it will help people to become more productive, take more ownership of the duties that they perform.
Another thing that I thought was very interesting about this report had to do with something that seemed like, when I thought about it, I thought, gee, why aren't we already doing that? And that had to do with how we buy our drugs. We have a whole group of people that we are purchasing drugs for, everyone from prisoners and Medicaid recipients to employees, current employees, retirees. Why not lump that all together? Shouldn't that lead to savings?
Well, very definitely, I think it can lead to savings. I was thinking about that issue on the way in this morning, and if we worked for Procter & Gamble, and Procter & Gamble said, this is going to be your benefits package, you need to order all your drugs over the Internet. We want to get the savings, and we want you to do it that way. It's not likely that the pharmacist or anybody else that works in the pharmacy or any of their friends would say, well, that's it, I'm not going to buy any Procter & Gamble products anymore. They've just about put me out of business. But I know that when I walk into Murphy's Pharmacy, I see Mark and Marla and everybody else that works there. When I make a decision as a legislator to say we're no longer going to do business, we're not going to allow that sort of acquisition through a small pharmacy, it becomes a very direct relationship. They're not going to buy me. And so I think that's the inherent conflict in making those kind of decisions. Now, I think those can be overcome by saying, all right, Representative Minor, if you want to offer that option for people to do business locally, then make them pay a higher premium. And I think most of us would say, give me that choice. For my prescription drugs, I want to pay an extra $10 or $15 in order to go and see Mark Murphy on a Tuesday morning and get my prescription filled because I want Murphy's Pharmacy on that corner. And I think that's the difference.
What about Mark Murphy trying to say, all right, I will match those prices so that I can be included in the plan as I always have been?
And I think that's what's happened. I think over time, most of the pharmacies, large and small, have worked to become very competitive. But I think what the business model suggests is that every pharmacy is the same, and it's the going through the front door, the attraction of having 50,000 state employees with a prescription card, where most of us think, well, they're going to make money on gum and soda and everything else. Some of these pharmacies aren't set up that way. Some of them have very small footprints. And so I think those are the things that we need to be cautious about. But I do believe that there's recycling of drugs. We have tens of thousands of people in the state of Connecticut that we provide prescriptions for that we don't recycle any of the drugs. They all come in bubble wrap. They're all kind of a captive individual, so they're administered by a nurse. They could be taken back by a nurse. So all of those things, there are a lot of reasons why we should look at this document and others and consider some of these changes seriously.
And you know, Diane, I appreciate what Craig was just saying. But the facts right now is this could save us $160 million if you go by the numbers that came to us through OFA and doing pooling. Speaking of drugs, pooling.
Pilling.
Yeah, pooling. Many states do it. Mm-hmm. It's a proven way to save money. Mm-hmm. It's a proven way to get the best bang for the buck for the consumer. We have to balance those. Those are decisions we have to make, but. On one hand, people are always saying, you have to do things leaner, you have to be more efficient, you want to save money, you need to save the taxpayers' money. Well, when you do things like this that absolutely will accomplish that, there are going to be the cause and effect comes into place. So, that's why Craig and I make the big bucks to make these decisions.
Let's talk a little bit about energy savings, because it seems to me that we've heard about the energy companies offering a home audit. Well, they'll come in and they'll say, here's where you're using too much air conditioning, or here's where you're losing on this or that or whatever. You did talk quite a bit about energy savings. Should there be a similar program for every state building or every building the state leases? Would that make any sense?
Well, I think it has to be something we strive for. Every building is different. Some are so darn old and decrepit. Look across the street at the state office building. But I want to touch base. I'm glad you brought that up a little bit on test bed legislation, which is something we passed a couple years ago in the House, and frankly, the state hasn't done a good job implementing. Which I'll try to be brief, but it basically allows state agencies to utilize products that are proven to save money, whether it's for your fleet of vehicles, whether it's for your electric costs, at the cost of the company that developed the product. No cost to the state. You run the test for 1 or 2 months, you see what you can save, because you develop that test, and then if it works, the state can purchase the product. You don't have to go through all the hoops. So we put some strong language in to ensure that state starts utilizing that. If it costs too much, if the product's too much and it's not efficient, you don't have to do it. But we put language in there to do things, again, carbon footprint, save money.
Mm-hmm. Craig, I worry about whether I'm wasting money at home on my air conditioning or my heat or whatever. Is this something that we need to really analyze in every building that we operate?
Well, I suspect that there is a reason for us to analyze all that stuff, but the real savings in the state of Connecticut isn't going to come from saving energy. It's not going to come from reducing the amount of lights or the amount of air conditioning that we put into this building. Mm-hmm. I think most of us know that the costs associated with state government have to do with how we deliver our human services and how we manage the population of employees that we have, both general government and through higher education. And those are really where the largest dollars are. So to the extent that we went through this process and we had what I thought were very good discussions about many, many items, expenditure line items in the state government, there's no doubt in my mind that if we're really going to get serious about trying to reduce the cost of government and make it more efficient, then we have to look at, when we buy a piece of equipment, is it really intended to replace a body? When you do that in manufacturing, the understanding is that if you buy a CAD machine, then it's going to become more efficient and it can run 24 hours a day, and theoretically you don't need as many people to stamp out that part. And that's really where the conflict, I think, comes in the document and in the conversation, is that while they're all good ideas and some of them are more easily attained than others, I mean, we can turn the thermostat down, we can look at a lot of different energy alternatives to try and save money. But those line items are very small compared to some of the large cost drivers in the state of Connecticut.
I'll just finish by asking you, what happens now? We did mention during the course of this conversation that some of these ideas have been cherry-picked by the administration and are implemented in the budget, or look like they will be. What about the document as a whole? You mentioned in your soundbite that we saw, let's not let this thing die now. Let's make sure it continues to have a life. So what happens?
Well, right now the bill as it stands is sitting in the Senate in the calendar, and I'm sure will be discussed. And I'm always an optimist. If things don't finish through this session. I think we need to go back and revisit the parts that we really want to implement and work hard to bring them to the administration. And again, we always have to keep proving ourselves. So we're going to continue to do that. There's so many good pieces. I mean, we could talk about this for hours and not cover it. So we're going to just continue to look for the good